Assalamualaikum and a very good morning to dear students and also to the participants who are involved in this module. I'm Muhammad Firdaus bin Bolong, an images physician and also a senior lecturer in University of Malaysia Sabah from the Faculty of Medical and Health Sciences. So today actually I want to present regarding this module which involves the interpretation of lateral cervical spine X-ray in trauma. Okay, as we know, lateral cervical spine X-ray in trauma is quite important, especially in the primary survey as an adjunct, where actually we can detect all the abnormalities and also suspected fractures or any misalignment of the cervical bones that will help us in managing this patient further. Okay, so as you can see in my slide, actually the indications for the cervical spine X-ray in trauma is actually guided by the criteria of nexus criteria and also Canadian spine rule, but the simpler ones is the nexus criteria. Okay, and actually in trauma the cervical imaging doesn't have to be a more complicated CT scan, but if patient is alert and conscious and can follow commands, so we can always obtain a plain radiograph views first, which involves anterior posterior view, the AP view, the lateral view, which is our context of discussion today, and also an open mouth view, which is to view the C1 and C2. Okay, so I just want to remind you that discussion is only regarding lateral view X-ray in this topic. So how to interpret or review a lateral cervical spine X-ray? Actually, it involves simple steps that actually can be done by our medical students and also in medical officers in the hospital. Okay, first of all, it's always to confirm patient detail and review the clinical history. Because why? We don't want to jump straight away to the imaging. We want to see the patient first. We want to review the patient first, and we want to know what's the history like. Okay, and then after that, second step is to confirm the adequacy of the lateral cervical spine X-ray. Okay, so in lateral cervical spine X-ray, it is deemed as adequate if we can view from the C1 cervical, the first cervical, until the top of the first thoracic, which is the T1. Okay, less than this, then the X-ray view is deemed to be inadequate. So maybe you have to repeat the X-ray, or you may have to progress to the next step, which is CT scan. Okay, so how to read this lateral cervical spine X-ray? Actually, it's quite simple. We go with the mnemonic of ABCS. Okay, A is actually the alignment of the vertebral bodies helped by the drawing of lines, which we'll discuss later. Okay, B which is bones, which is to assess each vertebral body and look for any irregularities in the cortex. Otherwise, C is cartilage, in which we assess the height of each intervertebral disc, and also S is your soft tissue, which is our prevertebral soft tissue, to look for evidence of any swelling. Okay, so we go to the first step, which is adequacy. So as we see now, in this view of lateral cervical X-ray, okay, I'll come up with a pointer. Okay, so if we see now, okay, this is the cervical lateral X-ray. Okay, so if we count the cervical which is visible, C1, C2, 3, 4, 5, and 6. So as you see, C7 here is not even visualized. Okay, this is another example. Okay, C1, C2, C3, C4. So this is an example of inadequate um, cervical X-ray. So in these instances, then we might have to repeat the cervical X-ray, or we have to proceed to the CT scan. Okay. Next, so this is a very good example of a adequate lateral cervical X-ray. Okay, as you can see, if we count the cervical, C1, C2, C3, C4, C5, C6, C7, T1. So this is a very good lateral cervical chest X-ray. Okay, and then we go to the alignment, which is the A. Okay, so okay, now we go to the alignment. So alignment, in the alignment mnemonic A, we have to draw lines, in the lateral cervical X-ray. So actually there are 3 or 4 lines actually that we actually interested in. Okay, the first line is the anterior vertebral line, okay, which runs through the anterior part of the cervical body, cervical vertebral bodies. The second is the posterior vertebral line, which runs to the posterior cortex of the vertebral bodies. Okay. The third line is the spinolaminar line, which runs at the anterior part of the spinous process of the um, cervical. Okay. And also the last but not least is the interspinous line, which runs through the posterior part of the um, spinous process of the um, cervical bones. Okay, so what we see in here is actually, if we draw the line, okay, notice that actually the line is very well curved. There is no interruption at all. Okay, so if there's any breakage, if there's any fracture, if there's any dislocation, okay, so we will see that these lines, okay, any of these 4 lines will be interrupted. Okay, so at that time, at the point of time, we must suspect there might be some degree of um, cervical injuries. Okay. Okay, next is bones, B. So B is bones. So if you can see, actually we have to see one by one the bones. Okay, the cortex, we have to see the cortex, see if there's any breakages in the cortex of the bone. Okay, so for example, this one, actually there is a teardrop fracture at the anterior inferior part of the C3 cervical body. Okay, so here the segment actually is fractured. Okay, if we draw a line also, okay, the anterior cervical line will be interrupted, but also the rule in the B bones, actually there's a breakage of bones here. Okay, and then another part is the C is the cartilage. So in the cartilage, actually we see the height of the intervertebral space. Okay, so the intervertebral space should be uniform, okay, or more or less the same. Okay, if there is loss of this intervertebral space, okay, there might be some subluxation, there might be some yeah, there might be some intervertebral disc prolapse, which might indicate any injuries. Okay. And also the last is soft tissue. Okay, ABCSS is soft tissue. Okay, so the soft tissue is where we look, actually is this part. This is the soft tissue. Okay, which is less radio opaque than our bones here. Okay, so this soft tissue, which is located at the anterior part of your cervical X-ray, okay, they will help you in reading the cervical X-ray. Okay, so what we do is we see the width of this uh, soft tissue. Okay, width of this soft tissue. Okay, so the rule is above C4. Okay, 1 2 3 4 C1 until C4. Okay, the prevertebral soft tissue shouldn't be more than 1/3, okay, of the adjacent vertebral body. Okay, if its width is 1/3, more than 1/3 of the adjacent vertebral body, then it might indicate a swelling. Okay, okay, so this prevertebral soft tissue swelling might indicate adjacent vertebral body fracture because of the hematoma formed by the direct impact, and also injury to the bone. Okay, and also below C4, the prevertebral tissue shouldn't be wider than one whole vertebral adjacent body. Okay, so if you see in this X-ray, okay, the soft tissue actually follows the rule of this prevertebral soft tissue swelling. So we might safely say that this uh, patient might not have uh, cervical vertebral body fracture. Okay.